Mrs. Johnson, it seems that your diarrhea has not cleared up.
Oh, no. I took the medicine you prescribed, but I am still having diarrhea. I've lost quite a bit of weight as well.
I remember in your initial appointment you said that your diarrhea was watery, yellow and foul-smelling, and that you were experiencing a loss of appetite and nausea. Now, along with this weight loss, I'm suspecting it is something else. Where was it you travelled to recently? Was it somewhere in Eastern Europe?
To Russia, at St. Petersburg.
Okay, so I think what you have is giardiasis. It is most common in the tropics, but is also found in Russia. I will need to...
Question 26. You hear a physician in the A&E department talking with a patient presenting with abdominal pain. Now read the question.
So, Mrs. Hardy, you're complaining of abdominal pain.
Yes, it won't go away, and it has become more and more severe over the last day. I'm also feeling nauseated and hot and cold.
You are probably dehydrated. Have you had any surgeries in the past couple of years?
Yes. I was treated for an ulcer about 5 years ago.
Well, I can see that you are running a fever, and that you are tender in the right upper quadrant and epigastrium. I'm going to order an abdominal X-ray and blood test to help us get a better look at what might be causing your pain. In the meantime, I'm going to put you on intravenous fluids to avoid dehydration.
Question 27. You hear a ward briefing about a newly admitted patient. Now read the question.
Okay, so last night a 35-year-old man was admitted after he presented in the emergency department because of a rapid onset painful swollen right knee. There is no history of trauma to the knee or previous joint problem, and there is no history of significant medical illnesses. The patient feels generally unwell and has noticed that his eyes are sore. His initial examination of cardiovascular, respiratory, abdominal, and neurological systems was normal. His right knee was swollen, hot and tender, with limitation in flexion. An X-ray showed soft tissue swelling around the joint. No other joint appears to be affected. Patient reported having recently travelled to Thailand on business. The probable diagnosis is post-infective inflammatory mucositis and arthritis, likely triggered by non-gonococcal urethritis. I have ordered urethral swabs to exclude chlamydial and gonococcal infections to get a cause for the urethritis and possibly for the inflamed knee.
Question 28. You hear part of a training on communication between providers. Now read the question.
I am here today to introduce a new role at our facility, as well as discuss some of the problems this new role is intended to deal with. First of all, the new role is Clinical Nurse Leader. We are assigning a clinical nurse leader to micro-units of around 12 beds throughout the hospital. The clinical nurse leader will primarily function as a liaison between physicians and patients, as well as a mentor to other nurses. As you all know, we have experienced a range of problems stemming from poor communication between providers. So one of the main purposes of this role is to get better information flowing faster so that decisions can be made more efficiently and more effectively. We think this will result in patients having a better healthcare experience, with fewer redundancies and in physicians having a better understanding of what happens to a patient when another provider takes over. Some other policies we are.
Question 29. You hear a trainee doctor discussing stress with a senior GP. Now read the question.
Dr. James, you have been a GP for 15 years, right?
Yeah, that's correct. I've seen general practice change quite a bit in that time. There is an increasing workload and pressure on general practice, so much so that many younger GPs are choosing to work as locum GPs or choosing to work abroad. I mean, the big part of the problem is from the lack of physicians choosing to go into general practice.
I've heard quite a few GPs talk about their days getting busier and longer in order to cope with increased demand, which obviously makes it incredibly difficult to juggle working life and home life, especially if one wants to have children.
Yes, 12-hour minimum working days have definitely become the norm, not the exception. I'm of the opinion that the current state of general practice is completely...
Question 30. You hear a conversation between a nurse and a doctor about scheduling appointments. Now read the question.
So, Dr. Alex, I've already spent over an hour going through the list of patients for this morning's diabetic clinic. I'm trying to decide which patients can be seen by the nurse and which should be seen by the GP.
Let me see if I can help with that. I mean, we already have quite a busy day with the second-year medical students coming in, which is going to reduce the number of patients one of the doctors can see.
Yes, every day is a case of juggling priorities and complex needs.
That is definitely true. I also have at least an hour of reports and routine administration with prescriptions waiting for me. I wish it were easier to get some temporary support until our colleague on sabbatical comes back, but...
That is the end of Part B. Now look at Part C.